The surgical procedure known as chin lengthening is medically referred to as distraction osteogenesis surgery. We utilize this technique particularly for patients of any age who present with a limited bone supply, or for those whose age have not yet finished their puberty phase, such as patients aged 5, 8 or 10 years old, meaning younger patients, particularly when dealing with anomalies present from birth or when they are young. We prefer this method in patients whose bone development is weak or deficient on the affected side following jaw joint fractures. We use this generally after examining the patient, if it is necessary to review the X-ray films. If we think it is necessary, we prepare a surgical plan based on the review of the tomography. In this surgical plan, we prepare the plan for how many millimeters we will advance the jaw, in which vector, vertical or horizontal. Under general anesthesia, we mount a device called a distractor onto the jawbone. We secure it. The apparatus called the distractor, which is mounted or placed onto the jawbone, begins to be lengthened approximately 1 week after the surgery. Our daily limit is 1 millimeter. With a limit of 1 millimeter per day, we can lengthen the jawbone by 20 to 30 millimeters, just like in a limb lengthening surgery. After reaching our goal, for instance, if we plan 20 millimeters of lengthening and achieve 20 millimeters, then there is a waiting period about 5 to 6 weeks, which we call the consolidation phase, for the gap we made to fill with bone. A waiting period, we call it. When this waiting period finishes, the 20 millimeter gap we made will be completely filled with bone, and after we confirm this with X-rays, we extract the device designated as the distractor that was positioned on the jawbone and thereby finalize the treatment. Fundamentally, this procedure is the application of the limb lengthening surgeries that our orthopedic colleagues, our professional peers, to the bones of the face. Therefore, whatever deficiency we have in the facial bones, whether it is the lower jaw or the upper jaw, we can lengthen it by however many millimeters of extension we feel is needed. There is no limit to this, and we are genuinely able to obtain very successful outcomes. Therefore, especially for individuals who suffer from this type of issue starting in childhood or congenitally, or for people who have children with this type of congenital problem, if they consult with us, we can successfully resolve their issues as well.